Hi, my name is Dean Hess, author of the 4th edition of Respiratory Care Principles in Practice. Before discussing the 4th edition, I would like to spend a moment describing how we got to this point. The journey began more than 20 years ago when my co-authors and I first discussed our vision for this book. Thanks to co-authors Neil McIntyre, Bill Galvin, and Shelley Mishu for sharing that vision for the past 2 decades. From the start, it has been our intent to write the most comprehensive, yet most student-accessible textbook of respiratory care. A major challenge has been to write a readable book without dumbing down the material. We have prepared the book with a consistent writing style throughout. We have minimized redundancy. Although we do not dumb down any of the content, we also strive to avoid making the content more difficult than necessary. Each chapter includes a number of features with the student in mind. Every chapter is richly illustrated. The figures were carefully selected and prepared to enhance student learning. Tables and boxes are included to expand the details of the text. The respiratory recap boxes highlight important concepts. Stop and think boxes are included to challenge students' critical thinking skills. The book is evidence-based as demonstrated by the up-to-date references at the end of each chapter and the inclusion of clinical practice guidelines from the AARC and other professional societies. What's new in this edition? First, every word on every page was reviewed and improved or updated as needed. No part of the book was left untouched. Here are some examples. The former chapter, non-invasive ventilation, is now non-invasive respiratory support. This includes coverage of high-flow nasal cannula, a topic that has exploded clinically since publication of the 3rd edition. The chapter on aerosol delivery is updated with new devices that have recently become available. The lung cancer chapter is completely rewritten by a new group of contributors. The COPD chapter is updated with the GOLD guidelines, and the asthma chapter is updated with the GINA guidelines. The CPR chapter is updated consistent with current guidelines. These are just a few of the important updates in the 4th edition. 2 brand new chapters have been added. The role of lung transplantation is becoming more important in the management of some respiratory diseases. A new chapter has been added on this topic. In the ICU, respiratory therapists commonly encounter patients with sepsis. Recognizing this, a chapter has been added that covers the respiratory care of patients with sepsis. Not only has the book itself been updated, but the online resources have also received a full makeover. These are designed to enhance the instructor and student experience using the book. The authors, contributors, and production team have put considerable effort into making this book second to none. It is the book that I have adopted for the courses that I teach. I hope you will do the same.